Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. In this segment, we're going to be speaking with Dr. Doreen Ezeife. She's joining us here from the Tom Baker Cancer Centre in Calgary, Alberta. She's joining us to talk about some new data that was presented at the International Association for the Study of Lung Cancer 2021 World Conference on Lung Cancer that highlighted the economic value of using the Guardant 360 liquid biopsy blood test to evaluate a patient's advanced non-small cell lung cancer. Welcome to Health Professional Radio, Dr. Ezeife, and thank you so much for taking the time.
Thank you. It's my pleasure to be here.
Well, give us a bit of your professional background and talk about what it is that you do at the Tom Baker Cancer Centre.
Yes, of course. So I'm a medical oncologist at the Tom Baker Cancer Centre. So I treat cancer patients with chemotherapy or other drugs. I treat lung cancer and thoracic malignancies, and I also treat breast cancer.
Now, this liquid biopsy, Guardant 360, it's been available for some time now. Is that correct?
Yes, that's correct. It's been available for a number of years now, and it's actually, I would say, about 5 years. It's been available and approved, and to the point now where it's actually on our guidelines. So the International Association of for the Study of Lung Cancer has their guidelines, and most recently the guidelines this year, they actually recommend using liquid biopsy if possible, if available.
What are the advantages of liquid biopsy when it comes to non-small cell lung cancer?
That's a very good question. Yeah, so liquid biopsy is an excellent test because it's less invasive. It's just actually a blood test. So a blood sample is drawn from the cancer patient, and that blood sample is harnessed for circulating tumor DNA, and that DNA is tested for any molecular alterations that are targetable. So it's much less invasive, and there's a faster turnaround time. So you get the results very quickly in comparison to tissue biopsy. So this is quite nice because for lung cancer, sometimes the tumor is in a location that is not easily accessible, or it's next to a major vessel, and it would be too risky to do a procedure to try and get a biopsy to do molecular testing. So liquid biopsy is quite nice in that allows us to perform molecular testing on these patients.
Walk us through this study that I mentioned. What were you trying to achieve?
Yes, our study was an economic analysis, and it was designed to study whether liquid biopsy added at the time of lung cancer diagnosis to help detect lung cancer-related gene changes is cost-effective. And our study was a multi-center prospective clinical trial, and it was actually conducted in 6 Canadian centers across Canada. So patients from these centers all participated, and they were newly diagnosed patients with stage 4 lung cancer, and data from patient survival was used to inform the clinical inputs of the economic model.
Now, when we're talking economically, obviously there's less time in a doctor's office, there's less equipment to use, the turnaround, as you say, is faster. What about accuracy as opposed to tissue biopsies?
Yes, so the accuracy is actually the same. So liquid biopsy, especially the Guardant 360 profile, uses a technology called next-generation sequencing. And that technology can actually detect over 70 lung cancer-related genes. And next-generation sequencing is available also for tissue biopsy. So when you obtain a tissue biopsy sample, next-generation sequencing can be done on tissue biopsy as well to detect any genomic alterations. So it's similar technology, this next-generation sequencing. But what's really nice about liquid biopsy is that it can get a better picture of a patient's entire tumor profile because it captures that DNA that's shed and in the blood, whereas a tissue biopsy, you're really getting a sample at the particular place that's biopsied. So if there are tumors in different parts of the body that are not accessible, then you don't have a picture of those, whereas tissue biopsy potentially has that opportunity.
Now, were you surprised by the findings of the study, or did you pretty much expect the outcome?
We were actually really quite intrigued by these findings because it's certainly surprising that adding a new test to a healthcare system can in fact result in cost savings in the long run. But when we really delved deeper into the results and performed the various sensitivity and scenario analyses, we realized what the reason for this was. And that reason was that the cost savings was really due to the fact that liquid biopsy increases the number of patients who can access targeted therapy, and thus reduces the number of patients who are inappropriately using chemoimmunotherapy, which would be the alternative if there's no genomic alteration detected.
So obviously, a liquid biopsy is significant in determining the course of treatment for a specific patient.
Certainly, yes. So when there is a gene change detected, that there's a targetable mutation, targetable alteration, then that patient receives targeted therapy. If there is no genomic alteration detected, then that patient would receive chemoimmunotherapy, which is quite a bit more costly than targeted therapy.
Based on these findings, what are your thoughts on whether or not clinicians will incorporate this liquid biopsy on a much wider scale? And secondly, how are you planning to use the results of the study?
Yeah, so that's a good question. I think that within the oncology community, we've known the benefits of liquid biopsy for several years now. Not only is it faster and less invasive, but it can also detect more cancer-related gene changes than tissue biopsy. I think that on an individual clinician level, our study results really affirm what we already knew, which is that liquid biopsy can detect more targetable alterations. Liquid biopsy can help clinicians find more patients eligible for targeted therapy. And we plan to use these results really at a health system level. Now that we see that there is a cost savings, I think that all these factors can certainly promote the use of liquid biopsy for more clinicians. Our study results have really been of interest to health technology assessment agencies in Canada, and we've provided these results to some of these health technology assessment agencies who are looking to implement liquid biopsy in the diagnosis of advanced non-small cell lung cancer.
Is everyone a good candidate for Guardant360 liquid biopsy testing?
Yeah, that's a great question. I would say that every patient who has a lung cancer diagnosis is a candidate. In fact, we use liquid biopsy for all cancers. So every patient with a cancer diagnosis is a candidate for liquid biopsy because we know that the biology of cancers is that they shed they shed DNA, they shed cells that float around in the bloodstream. And these are what's collected in liquid biopsy tests, is these cancer cells that are floating around in the bloodstream. And these cells that are floating around the bloodstream, the DNA within these cells, or the DNA that's shed, can be accessed and studied for targetable alterations. So every patient is certainly a candidate. This is a test that every patient can benefit from. Certainly, there are nuances that will affect whether the yield of the liquid biopsy test. So things like tumor burden or tumor shedding. So in some patients who have a very small tumor burden, they are less likely to shed cancer cells in their bloodstream. So there's a lower chance that the liquid biopsy test would detect circulating tumor DNA or detect molecular alterations. And in those patients, there may be it will be less likely that a molecular alteration would be detected. But certainly I wouldn't consider these patients not able to have that test. I would still try because we certainly know that every patient is a candidate.
Well, I sure appreciate you joining us here on the program this evening, offering this information, and hopefully we'll speak again in the future.
Thank you. It's been a great pleasure having this conversation.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Doreen Ezeife. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it at SoundCloud, and be sure sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.